Here we are, Sunday morning, Return to Healing. Andy and Alan are here,
Good morning.
and we're going to talk about an interesting topic that has affected both of us personally. It's currently affecting me now, but I mean, it's affected a lot of doctors in a very uh, adversarial way and in a way that is not clearly defined. And we're talking about medical boards. And for those who people don't know what they are, every state has a medical board. But as we learned in researching for our book, and also when I did research for other things about the AMA, medical boards were not always like that. Most states had multiple medical boards. For instance, African Americans weren't allowed to join the medical boards, so they had their own medical board. But so did people who had different views of medicine. And often the boards would clash. And one of the big parts of the Flexner reforms and the AMA reforms is each state was now allowed to have one acceptable medical board. And that medical board was basically a subsidiary of the AMA, which at the time, that's the American Medical Association, was the arbiter of what was right and wrong in medicine. And the reason people had to join the board is A, the board was the only place that offered malpractice, and B, lawyers sued even more back then, if you could imagine such a thing. And B, if you were going to get licensed, you had to be a member of the board. And the board was essentially a surveillance and disciplinary apparatus. If you strayed from what was considered mainstream medicine, if you practice any type of alternative medicines, if you allowed African Americans in, if you didn't believe in eugenics, which back then was proven science, you could be kicked out of the board. You could be disciplined by the board. You could lose your license, and it happened all the time. We've seen it, Alan, in our own life. It happened tremendously during COVID when any doctor decided to say anything. I was put in front of the board just for making a statement that was factual, i.e., there are a lot of people getting COVID in my buildings despite the mask mandate. That's all I said. And I got a letter from the board saying I was spreading misinformation. And that's the key word, Alan. Misinformation
Well,
is the
and,
key
and
word.
and Andy, it's the problem with the healthcare system is misinformation on so many levels, and you know, it's the society that we're turned into right now, like this, military type of going after people for almost anything is out of control. And to me, it's like a wonder like anyone still wants to go into medical school, and including our children when they hear us complain all the time, because these things happen, from the atrocities of the medical industrial complex, to the medical boards, to lawyers and malpractice and joint commission and rules and regulations and CMS and all of these things. It's just gotten like the joy of medicine gets kind of ripped out of you. And the whole medical board process has become, I don't want to say like a military kind of state thing. I don't think I'm using the right word. Come up with the right word for
No,
me.
I mean, it's
But
like
it's
that.
like you're not allowed to have an opinion and speak your word. And the other thing is the process in the world is someone just says something, and we'll go into the details, and if each state works a little differently because healthcare is regulated by the states, paid for by mostly the federal government and private insurance, but it is regulated by state licensure laws who make their own rules and regulations. But it's just gotten to the point that, you could be reported and have to spend a lot of money defending yourself for having a legitimate opinion. So like, and certainly COVID, brought it to the front page for people who never even heard of it before, because, doctors who were having their opinion, and some of them were just trying to do the right thing for people, saying, we had a disease during COVID where people were dying, where our approach was totally wrong. And if you bucked the system and talked about how our approach was wrong and how Americans were dying more than the rest of the world, which is the truth, you got in trouble.
Yeah, and that's why I got in trouble just for, and I wasn't even making I didn't do anything. And here's the whole thing. There's one thing the board is supposed to go after you if you've done something illegal or unethical. For instance, one of the biggest things the board goes after is people who make money off misinformation. Now, Alan, I could tell you every day that the cardiologists do that. They tell people they need a stress test, they need an echocardiogram, like you said, when they had one last week. Um, and they make money because it's their machines and they get paid for the test. So defining misinformation has become the job of the specialty societies. And so when I got in trouble this time, it was because I was not following the mandates of the American College of Cardiology. Now, to me, the American College of Cardiology makes statements that I think are antithetical to geriatric care, and that's mostly what I do. That's taking care of old people, i.e., the blood pressure guidelines said to get everyone's blood pressure below 120. Now we know I have tons of patients. If you push the blood pressure below 120, they're going to faint, forget, be tired, not be able to function, and maybe get little mini strokes because they don't have enough pressure going through their narrow arteries. So this blanket line that they drew in the sand is and with cholesterol too, and something I question all the time, like when I write newsletters. But I don't just question it like musing out. I question it by using studies that other people have written in major journals, and
No,
that was considered misinformation. And when I looked it up, Alan, legally, it says medical boards, because again, what you're saying is a war. They are a disciplinary apparatus. They always have been. They want to make sure you stay in line. So you could have every article, great double-blinded study around, and doctors to back you up. But if what you're saying goes against the medical norm as defined by specialty societies, then you will get in trouble. So that's what boards are enforcing, is that you become a non-thinking, non-questioning, non-skeptical doctor and simply go out on a leash and do what they tell you to do, which is basically defined by pharmaceutical companies and the specialists.
right. So you bring up a couple more points. So, you know, the specialty colleges, I didn't talk about them earlier, but, they rule. And the patient specialty colleges, like the Diabetes Association and the American Heart Association, and all these people have boards, which are specialists, and they make up rules to feed, their pocketbooks. Um, and questioning that, will get you in deep, deep trouble. So we're kind of up against everybody who's against us in primary care for just trying to do what's right for a patient. So when a cardiologist says, well, your stress test is equivalent. So, but, we need to do a cardiac cath because you have a history of coronary disease. But we know that the treatment for asymptomatic coronary disease is aggressive medical management and lifestyle modification, and not interventions like angioplasties and stents. But they get away with doing it, and the data clearly shows that at least 70% of interventional cardiac procedures are unnecessary. And just to bring it up while it's on my mind, because you brought up another point, I don't know if you saw this week or if I even shared with you. So BMJ came out with an article actually this week showing significant rises in mortality rates when you try and do tight blood pressure control.
Wow, I didn't see that. Send it to me. Please, I want to see it. But the BMJ is, and was called the British Medical Journal. It's funny, Alan, because a lot of the studies that I end up using are from Europe, and they are Europeans because the healthcare system is either heavily subsidized or run by the state. They're much more interested in doing things right. And by the way, so is the VA in our country. So a lot of studies come out of the VA, they come out of our country. They want to do things right because they have to pay for healthcare and they want to get the best bang for their buck. That's why they live longer than us and do very few stents over in Europe and the stents they do are super cheap. They're a couple $100 instead of, a few $1,000. But they have created a system that has normalized doing these things that the cardiologists want to do. I could show them that article all day that the blood pressure guidelines are causing more death. I have articles showing that tight control of cholesterol in elderly is problematic. They don't care. And what was so shocking to me when I read about the boards is multiple courts of both political parties have given them free rein. No, they do not have to follow due process of law. They do not have to allow for free speech. They don't even have to justify why they take away your license or reprimand you. They have free reign. It's what we call extrajudicial, which means it's outside of the Constitution. Just if you ruffle the feathers, as we're doing here right now, Alan, if we ruffle the feathers of the precious people who need to make money off spreading what I consider misinformation um, to you, then I'm accused of misinformation. It's very Orwellian that the people spreading this stuff accuse everyone else of that word misinformation, and the media has taken it up. And I know a lot of people who take up that word too. Oh, misinformation. I'm reading a book now on focus, and he talks about how we need to stop the internet from spreading misinformation. And I'm seeing he's talking about stuff we're saying as misinformation because he doesn't know, and that's what he's been told. So it's like majority rules when it comes to the boards. And again, you go back to the time when you and I were involved in the war against opioids. Well, back then, which wasn't that long ago, we were told there's a fourth vital sign called pain. We had to report it and we had to control it. And we had to control it through opioids. And who is creating that fourth vital sign? The drug companies, various organizations that drug companies financed, and specialty societies, all given money by the pharmaceutical companies. It wasn't just one. We hear about the Sacklers, but all the pharmaceutical companies were partaking in this. And those of us who push back could get in trouble. Now, you look backwards and say, wow, those guys were really trying to make a
No.
difference, but
So,
not at the time. It wasn't like that. I was,
now, a lot of this is not good times, and a lot of this is just very depressing. So let me take a minute or two and talk about, one of my cases that I had since you brought up the opioids. So, people think we have a million drugs to give people for pain, but we really don't. We have opioid analgesics and non-opioid analgesics. Non-opioid analgesics are pretty much, the Tylenols of the world and the Advil, Aleve, Motrins of the world. And then you have what people call adjunctive medicine, which is, medicine that we use like anti-seizure medicine like gabapentin and antidepressants like duloxetine to help with some of the neuropathic pain syndromes. But otherwise, it's opioids. And there's only really about a half a dozen opioids that are a reasonable price that you could prescribe for your patients that don't interact with the world and are not $1 million. And you know, in elderly people, and most of my practice is elderly as well, even though I'm a family doc, but most of my practice is elderly, and I also practice pain and hospice and palliative care, which makes it even higher and makes me even more of a pain expert. It's one of the few things I really feel exceedingly knowledgeable in against the average, let's say, family doc that's out there in prescribing. So, you get an elderly person, 80 years old that has severe degenerative arthritis of their hips or spine. Most of these patients are hypertensives and diabetics, and we know you could only give them so much Tylenol and so much Advil and Aleve. And we know that these other drugs like gabapentin and duloxetine and stuff and tricyclics have more harm and don't really affect non-neuropathic pain from joint diseases that little old ladies get. And we get our patients who, can't even go to an occasion from their family or go shopping for the day or take a vacation because they're in such pain. But giving them a low dose pain medicine like a Percocet or something makes them easily able to do it for the day. And, I've never made an addict out of a little old lady or a little old man. And, I prescribe them judiciously. I tell them how to use it. But sometimes it gets worse. So in one of my patients, the woman, you know, you see them come in with the cane first, and then, the next time you see them come in with the walker, and the next time they're in a wheelchair, and it's from degenerative arthritis, and you feel bad because they can't even do anything, and you start prescribing some stronger medicines for their benefit, and like I'm trained in this. And one of the last things I ever choose is a drug called methadone. Methadone, many people might have heard of. It's used for as a strong painkiller, but it's also used for substance use disorder or heroin addiction and fentanyl addiction. And I prescribed it after a long discussion of nothing worked. I went through every painkiller that this woman could be on, and I had nothing left to try, and she couldn't do anything and was miserable in her life. And I prescribe it, and literally like 6 weeks later, I get a letter from the state medical board that my license is under investigation for allegations that I indiscriminately prescribe opioids. And I'm like, what the heck? And like at the time, I had no idea where it came from. Like, did they not know I was a pain provider? Did I not know I was a palliative care provider? You know, hence I have to now get an attorney. You have to pay for an attorney. Fortunately, I have in my malpractice policy a rider that gives me some money to pay for some of this. And I reached out to an attorney friend I know who represented me. But it took a year of hell for me to have my license investigated. They did runs of every opioid I prescribed. I had to have a hearing in front of these people. It was virtual, but I had a hearing with a lawyer. I got questioned. And I quickly found out who it was when the allegation was related to inappropriate use of methadone, and I had just prescribed the meth. So it's like
Who, who who's the one who reported you though?
so the one that reported me was her son. I think I might have told you this story, and her son just happened to be a New York City narcotics detective.
Oh, that you did say that.
So he was just not happy that his doctor gave his mother methadone. So
And that just shows you also, the medical world that we live in is full of uncertainty. I think I put in an Osler quote that said, if every patient was exactly the same, then medicine would be a science and not an art, i.e., it can't be a science that is generic for everyone. And our views of what's right and wrong change and shift based on the age of your population and the time. So at one point, we got yelled at for prescribing too many, I mean, for not prescribing enough opioids.
exactly.
Um, and that was heresy. Then the pendulum swung. I know myself and someone else wrote an article about how, judicious use of opioids, using it as an adjunct, and like you say, Alan, I mean, you deal with this much more than I do. But a lot of my patients will get harmed more by taking an Advil than by taking a low dose Percocet. Um,
Absolutely.
and the other medicines, like you say, cause problems. So judicious use of these medicines has allowed my patients to walk and function. You mentioned methadone because I have a patient who is literally crippled by restless leg syndrome. And she went to a doctor who gave her a low dose methadone, 2.5 milligrams, and cured her. It
Yep.
saved her life. And you know what? She said, "Can you prescribe this?" I said, "No." I said, because that's going to be a flag. If I prescribe a medicine that you're doing great with, it's not going to give you any but let's face it, people go on methadone to get off addiction. So
Yeah.
so the idea that it is going to, cause people to have no one's selling methadone on the streets. It's just not happening. So, but it's just in the heads of studies don't matter. You did something, got in trouble. I said something and got in trouble.
And I
That's all.
documented appropriately. I managed appropriately. You should tell them a little bit about how your recent, well, during COVID, I think because there was so much information coming from the White House and the CDC and all the regulations that I think, anything that was said in print or whatever was looked at. Um, and some of it was real, people who were selling, drugs that are gonna, save your life, if you take this drug during COVID and actually had zero evidence. So, I saw that, but when people were giving their opinions about a vaccine or masking, this vaccine was totally unproven. That there's some evidence that perhaps the vaccine caused more harm than good. It depends on what you read. And we know there are many countries that didn't vaccinate like we did and didn't die like we did because they just got, herd immunity from the community, which we know is a better kind of immunity. So I think you should tell a little bit about like how your cardiology case came because I'm still mind boggled by it.
Well, yes, I mean, and this is really scary because my cardiology case I was reported to the board by the local cardiology group. I actually consider the local cardiology group quite unethical, that things they've said. Alan, to this week, they told my patient, who is a marathon runner and eats well, but has a cholesterol of 120. And because they kept bugging her, and I did a calcium score just to show she's normal, and it was 50, which is normal. And the cardiologist says that you're going to get a heart attack this week with that score. If you even have a score of one, you should be on high dose statins. The
You
woman's
might
scared
not
to
even make
death.
it through the week.
She maybe not, because I also had in this same group. The cardiologist told one of the patients, if you don't go on blood thinners, you're going to get a stroke before you get home. They do stress tests on everyone, stents on everyone. They're pushing the watchman on everyone. This is an unethical group, and they're the ones who reported me. And all what they reported to me was something in my newsletter that listed studies, that looked at older people. Some of the studies were ours that we wrote for the American Family Physician that say, well, let's put a little caution in the wind when it comes to treating cholesterol or when using GLP-1s, or pushing blood pressure too low in every single patient. They were just studies. And basically the board said that this is a legitimate complaint and they're taking it up. I actually, because I've been wanting to do this forever, and I just didn't think it was a good thing to do. I reported them for all the stuff I told you, and the case was dismissed in a week. They didn't even look into it. They didn't ask me any questions. They just dismissed the case against them. Against me, the case being that I put studies in big journals in my newsletter that they didn't like, the precious cardiologists. The board considers that a legitimate complaint, and and I didn't make money off it, right? I'm not selling my newsletter. No one would buy it anyway, but it's just
But the
for
cardiologist must have read it.
someone gave it to them.
Okay.
But
Oh, okay.
that's the
Now,
same thing,
how
like
did
the
you know?
sun.
So is it public in your state of who reports you? Because in New York, it's private. I figured out who reported me, but
Yes, it was public. I mean, they sent me the complaint. It was Dr. Michael Silverman, a cardiologist, and his friend Eric Swartz, who's the guy who puts everyone on Watchmen and blood thinners even when they're falling down. He's a guy who someone was gushing blood, losing, had to get 6 transfusions, and he said, "Well, we can't keep this blood thinner off. We have to
right.
keep the blood." This is
So
what
it's interesting in New York though. Like they told me right off the bat, like they're starting this case. They haven't even looked at it yet, but they are required by like state statute to investigate every complaint. So I don't know if that's true in every state as
it
well, but
is.
what? But why didn't they investigate your complaint? Or they did, and they said, okay, I know the cardiologist. He's a good guy. He must be right.
That's what it was, because they said they investigated, and I wrote back. I said, "That's funny because you didn't ask me for any information." I said, "I have a lot of information to give you, but I'm not going to put it in the complaint because it dealt with patient names,
hmm
and I didn't know how much they needed, whether they needed the names or not, but they never asked me for it." So their investigation was, Mike's a good guy. We're not going to mess with him. We love the guy. We go to Bermuda with him. So yes, the board. That's the other thing you have to know about boards. They are run by specialists. We
Absolutely.
don't have time to be on the board, Alan. You and
We have to work. We're too
we have to
poor.
work. We have to work, and they also view our job as referring to specialists. So they value us in that way. But Alan and I rarely do that. So we are really on the S list with these guys. But yeah, here. So imagine practicing medicine with all the other garbage you're talking about, but knowing you could just say something for the good of your patient. Wait a minute. Why should we be lowering cholesterol in a 90-year-old with dementia on high dose statins when, first of all, it seems insane, and secondly, there's not a single study that would support that? Just saying that will get you in trouble with the board, because now the consensus is everyone must get their LDL below 70. And by the way, another one of these people just this week told my patient who was on high dose statins and whose LDL was about 70, you know what? You can't get it too low. If we can get it to zero, that would be the best thing. You would die, Al, if it went to zero. God, they have no idea. You can't get too low for them, but that's considered the medical norm now. It's insane how it should. And I'm like, but I'm geriatrics. Shouldn't I follow a different norm? And they said, well, we're investigating that. And this investigation can take a year. I mean, who knows? And the power of these boards is beyond control. And
Yeah,
God only knows.
and the other thing is, So I happen to be the chair of the credentials committee in my hospital, and it's always embarrassing for me because you know, these things don't go away. So when you fill out an application as a doctor for anything, whether you're applying to a new insurance company, hospital privileges, anything related to be a doctor, you have to fill out, tons of paperwork. And on every one of these things is, has your license ever been the subject of an inquiry from a state medical board? It's a question on every one. And I have to write yes every time and explain it. It's, to me, a case that's found, unjust without merit should be dropped. It's like they expunge people's like murder records when they're found, without merit. But, the doctor who, has a malpractice case that was dropped, like you have to put that case on there that it was dropped, or you settled for $5,000 just to get the person to go away. There's just so much against us. And like for my rest of my life from that, every time I fill out, we have to fill out our hospital privileges every 2 years. I'm sure you need to do the same with all the nursing homes that you're on. And, reattestations for insurance companies.
Yeah,
It's
I'm the same boat. I have to put this stuff down, even though, again, I was trying to say, look, guys, with the mask thing, I just said, okay, we're masking everyone. Everyone's still getting COVID. I actually had a suggestion that people get tested when they walk in these buildings because these were the buildings of high vulnerability. That's what they were doing in Japan and Korea, and I said that, and they had no incidents of COVID in their nursing homes. Again, that would sound to any reasonable person like, okay, I'm observing this science, right? I'm observing that something's not working and proposing a solution that's a little more onerous, but would has been shown to keep it out. And instead, I get a letter from the board that my license under review, have to hire a lawyer. And you know what the punishment was, Alan? This is crazy. I've seen some, you could write a book about the punishments because they have nothing to do with anything you were accused of. My punishment was we have deemed that you were spreading misinformation, and in the future, your license will be suspended if we see you say anything negative about the COVID vaccine. Now, I hadn't said anything negative about the COVID vaccine, but I did after that because I'm one of these schmucks who doesn't like to be shut up. But, it's free speech. And I'm not making money off the speech. I think it's science is about hearing multiple opinions.
And you're giving your opinion. That's not just your opinion. It's
And it
based
wasn't.
on your knowledge and what you've read,
Exactly.
So
And many
when I
other people have the opinion, but not the right people.
right, the same cardiologist could, report you and I for, telling people that, if you try and get your blood pressure too low, you're going to pass out, you're going to fall, you're going to break your back or your hip. That's just the truth. And there's numerous articles to show it. But again, they're going to say you're spreading misinformation because the lower the blood pressure, the better, because that's their opinion.
Right. There
And
was a
they're
study this
and
week
they're the
too that
specialists.
looked at that with falls. Any blood pressure medicine you're on increases your fall risk. So as doctors who are thinking, we say, well, what this 90-year-old is much more likely to get harmed by a fall than by the blood pressure being 130. So that's what we think. So we're gonna talk to the family and the patient and probably get them off the blood pressure medicine. That's misinformation in today's day, and we're living in an Orwellian world in medicine. When I talk to my kids and things about this, they say it can't be like that. That's not possible. That they have this much power to shut you up and to direct how you think. But they do. And the only reason that I haven't been reported multiple times is because no one actually used to care about it. I was like an ant, but I don't know why they decided to do it this time. It was kind of funny, but. Yeah, we'll see what my lawyers. Anyway,
Now you guys
so
still have patients together, I assume, correct?
yeah, I have not referred to this group for 10 years,
Okay.
but they are the main cardiologists in the hospital.
Ha-
So
ha-
they get anyone who ends up in the hospital. And yeah, but I tell my patients, I say, just be careful. They're big on, they'll do stress tests and carotid ultrasounds every year. And they're like, why carotid ultrasounds? I said, I don't know. The board of the American College of Cardiology says don't do it, but they
Yeah.
get paid to do it.
No, and every community has one of these docs. And again, in specialty realm, self-referral, which what this is allowed because they own the carotid machine, they own the echo machine, they do nuclear stress tests. So, they're feeding themselves, you know, and again, we have one in our community as well who I would never refer to, who does annual, like you said, carotid Dopplers, abdominal aortic sonograms, echocardiogram, and a nuclear stress test. And probably from those four tests, he makes like $3,000 or $4,000, and it's a crime. There's radiation exposure. I always ask, I said, do they tell you not to go near your little grandchildren when you come home after the nuclear stress test? No, why? What's the problem? I was like, well, they just lit you up, and exposing it to your little grandchild is not a good thing. They don't even tell that to people. Like they could trigger like the Geiger counter at the frickin' airport with that if you go too soon. No, they definitely do. And these people are like, what? Oh, they don't tell me anything, but they're the cardiologist, they're God. It's
At most they peek their head in the room during these, and the AI reads them anyway, but they're still
yeah.
getting thousands of dollars for not thinking and just doing to people what it's not needed. And we get in trouble because we think too much. And
Well, folks, I got to tell you, your health is in jeopardy, and we're going to get in trouble for that too, because primary care is dying as a field because we have to work so hard to make $50 and $60 on an office visit, and we don't do all those expensive tests that make us thousands to make up the difference. So we have to see more of a volume and run to the hospital, and Andy has to run to the nursing home or 20 of them. And it's getting harder and harder, and the specialists are making more and more money. And I just had a patient send me an in-basket message. I think it was like exostosis something that she went to an orthopedist and they said this is what she needed. And I looked it up and it was like various creams for aging. And and I'm like, you went to him for your knees and he's selling you anti-aging cream. It's
it's
like,
insane. Yeah, a lot of primary care, that's how they make money is sell these things too. But Alan, when I was in medical school, and just end with this, I was in New York. But most people in internal medicine went into either GI or cardiology, but they knew why they were going into it. Now they pretend like they're really interested, but they said, well, should we do scoping for dollars or
yes,
capping for cash? That's what they would say. They knew why
exactly.
they were going into these fields. And a lot of people, when I complain about the unequal distribution of payment, they say, well, you knew about that going in. I said, I get it. I'm fighting the system, but I'm not fighting the individual cardiologist because they're part of the system. When they report me for talking, that crosses a whole different line. I get that the system stinks and it overpays people to do bad things to you, but when they stop people from having a discussion about it, now we're living in basically a totalitarian regime,
Yes.
which is not that I don't know if people know that we're not allowed to even talk anymore, and that the board that's going to be our judge, jury, and executioner does not have to follow the law, and they don't even have to justify what they do. So that's where we are now. And yes, it's really hard. Someone just told me, well, just keep your head down and just take care of your patients and don't say anything crazy. I said, by crazy, I mean truthful or questioning things. They said, just, you're at the tail end of your career, just do that. And I'm like, no, I can't. I can't. So this is going to be our life then, because, people like us have a target on our back. So
Yep. All
anyway,
right.
Alan, have a
Return
good,
to healing. You got to read our book, folks. It's all in there, all of this stuff. And
everything's in there and documented.
yep, evidence.
Evidence.
All
Okay,
right.
take
All right.
care.
Have a good week,
Bye.
everyone.